In this video, I'm going to show the anatomical landmarks of FIS. FIS is fiber optic endoscopic evaluation of swallowing. In this exam, we observe directly the movement of structures during the function of swallow. So, this provides a precise and objective evaluation of swallow. It was first described by Langmore in 1988. Nowadays, it is a standard tool for diagnosing and treating dysphagia. Speech and language therapists use endoscopy for swallow evaluation to diagnose dysphagia, to assess the nature of the problem, and to guide the dietary and behavioral management. I'm going to start with the epiglottis. The epiglottis should invert to meet the arytenoid's cartilage to protect the airway entrance. Behind the epiglottis, we have the tongue base. The tongue base should retract during swallow to meet the posterior pharyngeal wall. Between the epiglottis and the tongue base, we have a space called vallecule. In this space shouldn't have any residue of food. If there is, the probable cause of this is the weak tongue base retraction. And behind the posterior pharyngeal wall, we have the upper esophageal sphincter. The upper esophageal sphincter opens to pass the food when the larynx is elevated. Here we have the aryepiglottic folds, or the lateral walls of the laryngeal vestibule. So the aryepiglottic folds, or the lateral walls of the laryngeal vestibule, are the major effector of epiglottic inversion as closing the laryngeal vestibule during swallowing. Here, between the two arytenoides cartilage, we have the posterior commissure. Here we have the anterior commissure. The anterior commissure is the anterior fissure where the vocal folds came together in the middle line. Here is the laryngeal vestibule. If there is a transgression of food inside that space, is regarded as laryngeal penetration. Here, as we can see, are the false vocal folds. False vocal folds are the inferior border of the laryngeal vestibule and need to adduct during swallow. So the false vocal folds need to adduct during swallow. Here are the true vocal folds. The true vocal folds adduct along with the arytenoid medialization. So with the arytenoid medialization, the true vocal folds adduct. And between the true vocal folds and the false vocal folds, we have here the space called ventricle. As we can see, here are the rings of trachea. If there is transgression of food to that space, because it's below the true vocal folds, it's regarded as laryngeal aspiration. Here, those dark spaces are called as Piriformis Sinus. Shouldn't have any residue of food on it. If there is, the probable cause of this is the reduced hyolaryngeal excursion.